The world as we once knew it has changed. The simple embrace of a hug and the universal greeting of a smile is very hard to come by as a result of COVID-19. We have now learned to either nod and or give elbow bumps, at best, and master the task of hugging with our eyes. Yet even more so, this pandemic has caused a snowball effect of social isolation, financial stress, academic stress, hopelessness, increased substance abuse problems, and even suicide. A snowball that has ultimately resulted in so many meltdowns. COVID-19, with its necessary but preventative restrictions, has demanded for people that were once able to congregate, whether it was for spiritual, intimate, or entertainment purposes, now to virtually gather in the confines of their homes alone. According to NAMI, National Alliance on Mental Illness, in 2019, the Health Resources and Services Administration described a loneliness epidemic as an increasing societal health concern. Yet further research by Cigna produced a report that identified Hispanic respondents, 47.7%, and those who identify their race as other, 47.2%, were loneliest, followed by Black African Americans respondents, 46.3%. Amongst people of color, where the struggles of unemployment, financial stress, substance abuse, and worse access to health care with poorer health outcomes already exist, a new struggle has reared its head as well: an increased rate of suicide attempts amongst Black adolescents. Black adolescents had increased rates of suicide attempts, while rates declined for other race and ethnicities. COVID-19 has triggered the African American community as an extra layer of that snowball because the everyday stress that Black people were already facing has been compounded and magnified, which has affected the emotional and mental health of the community. Within the African American culture, unity has always been its strength. No matter how bad things became or how dismal things looked, the entities of the Black family surpassed whatever was going on. But COVID-19 and its restrictions has disconnected that unity. Yet, there is never a better time to seek help. It all starts with awareness. If you find yourself suffering from loneliness, depression, lack of access to health care, lack of food, unemployment, substance abuse, domestic violence, and/or thoughts of suicide, there is always help. Sometimes it takes the effort to confide in a friend, a clergy, primary care physician, your sponsor, your teacher, a family member, or your therapist, whomever it may be. We all play platforms for one another, even in a pandemic. We understand that the struggle is real and often difficult to face. However, you will know that change is beginning when you make that first phone call. You will see change happening when you open your eyes to see someone there waiting to greet you and welcome you into treatment. You will feel change happening when you begin the journey and start to experience people helping you along the way. And you will know that change has arrived when the struggle you once faced is your strength to walk into the sun. Please utilize the resources that are listed on your screen. However, if you need assistance with contacting these resources, please feel free to call Black Family Development at 313-758-0150.